Here, we are going to have Professor Stefan Ihde, the modern father of cortico-basal implantology or strategic implantology. He is doing the his mentor. You know who was his mentor? His mentor was Professor Limkov, the legendary Professor Limkov. And whatever the knowledge, the true knowledge of the bone and everything, he had done his own research and he's passing to us. And when you know about the bone, then you know what the mistake and what you can say the myth, the convention implants has been all around with the rough surface implantology and the bone rules like that. So Ihde sir is going to tell about the truth about the bone grafting, and the bone grafting, he always say it just creates it's always negative for the effect of the bone. And there is a recent article, the recent article was been published from Japan also, that whatever the bone augmentation materials you people are using, it's creating a bone jaw necrosis actually. The osteonecrosis is occurring because of this unresolved or non-resolved graft materials. And what is the other thing is, when you use an implant that is resisting the bone isoelasticity. So it always, what is going to happen, the bone is going to kick out that implant. It may be sooner or later. So as our doctors, it is always say, the sooner the implant goes, it's better actually, so that we can place a more predictable implantology and the patient can be happy. So it is thank you very much to be online and to have actually this wonderful, amazing session. Thank you very much to be a part. Good morning, sir. And sir, yes, it's all over. It is, sir. You can take over, sir. Thank you very much, sir. And thank you, Tonia ma'am, also.
Yeah, thank you very much, Dr. Vivek. Hello to everybody from Moscow. Today's topic is Peri Implantitis, and you see already on the first slide a lot of implants being affected by Peri Implantitis. And Peri Implantitis is as we all know, hopefully also you know, is a real problem. It's occurring almost in all cases, sooner or later. The question is only how much Peri Implantitis is the patient going to have. But it's a disease which is connected only to the large diameter rough two-stage implant. So we are very lucky to know this today. And the only way that we can, work against it or avoid it is simply not to put these implants. Unfortunately, our profession has been misled for many years, I would say since the beginning of the 90s. And this type of implants have been made fashionable, so they are being taught by the universities. Universities get lots of money for telling us this. And in fact, the patient have a lot of problems with the two-stage implant. So this is what I'm going to talk about now. About myself, I was born in 1962 in Immenstadt in Western Germany. There were two Germanys at that time, if you remember. I studied in Würzburg. This is in northern Bavaria, but in the south of Germany. And then I worked in Germany after the university and after the army. Then I went to Switzerland, worked there many years as a dentist and implantologist. And in 2012, I moved to Montenegro. This is a part of former Yugoslavia. And I live there with my family and work there. In all those years, I have written 102 national and international publications. I wrote 7 textbooks. My mother language is German, but I speak English, of course, and I understand and speak very well, in the meantime, also Russian language. I'm licensed in a number of countries as a dentist and as a surgeon because I give so many courses, and it's the requirement of each of these countries to get a national license. So you see the list of countries here. It's not so easy sometimes to keep all these licenses alive. You have to prove the continuous education, insurances, and so on. But in any case, I need this to be allowed to teach legally in these countries. In Russia and Ukraine, I had to pass the exam as oral surgeon in each country because only oral surgeons are allowed to put implants. I have worked 1996-97 with traditional implants, so with two-stage implants. At that time, there was an Israeli company, Alpha Bio, and I used those implants. Not sure if they are still on the market. But then I switched to basal and cortico-basal implants. So since 1997, I worked mainly with disc implants, later the BY implants. So these are these lateral implants. And after 2006, I started combining these lateral implants with the BCS implants, so with the basal screws.